Hi, I'm Bob Schrupp, physical therapist.
Brad Heineck, physical
And
therapist.
together we are the most famous physical therapists on the internet.
And our opinion, of course, Bob.
All right, Brad, we're going to talk about nerve flossing or nerve gliding. I've even heard it called nerve mobilization. They're all little different variations of the same thing. Basically, you're trying to get some movement in your nerve that may have been scarred down a little bit, maybe some scar tissue on it. And when it gets scarring on it, it actually can give you pain. So this video, what we're going to do is show you what symptoms you might have. You just kicked my foot, Brad.
Well, I know, I was trying to get your attention.
In this video, we're going to show you what symptoms you might have and which nerve glide you might try. Because there's 3 nerves in the upper extremity, Brad, that you can do glides on.
You bet.
And then there's the big sciatic nerve.
Right.
So let's start with the first one, the median nerve. That's the most common nerve in the upper extremity that you're going to probably have involvement with, because that's with carpal tunnel syndrome.
Sure.
So a lot of people get carpal tunnel, obviously, and that's the median nerve. The median nerve comes off of C5T1, which you don't need to know, but it comes off the neck, off the nerve roots, comes down, kind of down the front here, and it goes into the hand. Now, if you have numbness or tingling or pain, and Brad, let's come on up here.
Yes, here we go.
If you have numbness or tingling or pain in the green area here.
That reflection there.
Oh, are we okay now?
Let's level it up. Good.
All right. So numbness or pain or tingling in this area here, the green area, which is the thumb, the index finger, the middle finger, and part of the ring finger, and also on the back there, then you may be having some carpal tunnel syndrome symptoms, and you may want to try this nerve floss for the median nerve.
Did you draw these, Bob?
I did.
That is
Isn't that
incredulous.
something? Incredulous.
Okay.
Now, one test for that, by the way, you want to show the Phalen's test, Brad?
Sure.
Right.
Right. So it's like you're praying,
Yep.
but you go like this until you get to the end range of your wrists.
And that will make your symptoms worse if you have carpal tunnel. You can also do reverse Phalen's. Yeah.
And you need to hold it there for 30 seconds to a minute or so.
Right. Exactly.
Tingling, numbness, those symptoms will be reproduced.
So, if you want to try the median nerve floss, go to our video, right? I'll put it over here, right there. Right, I'm gonna cover your face, Brad.
Yeah.
Right there. Okay, now the second nerve, second most common nerve in the upper extremity is the ulnar nerve. The ulnar nerve comes off of C7T1 more on the, but it goes down more the inside of the arm and goes around through the elbow here, and then it gives sensation or feeling to these 2 fingers right here. Now, this is the one that people often, when you hear people hit their funny bone, that's their ulnar nerve.
Yeah, that little groove in there. It's the baby finger, the pinky finger, and half of the ring finger.
Right. Let's show them.
Yeah, let's look at this. We got a nice drawing here, Bob. Let's take advantage of it.
All right, so here it's the red area. You can see the red area on the back and on the front. Now, again, you get tingling, numbness, pain in those areas. Also, I would say if you got pain on the inside of your elbow, it might be a possibility that it's nerve pain. Now, the other thing quite often cyclists can get this.
Sure.
I think they call it cyclist palsy. And it's those people who have with their bikes where they're leaning on their forearms.
They're called arrow bars, Bob.
I'm glad that you know that, because I'm not that. I'm into cycling. I just started, but I'm not that far into it.
Sure.
So, but Brad said he often gets more of the numbness, which he's probably from the median nerve, isn't
Right,
it?
when I'm riding on the bars and I have the pressure against my hands there, and it's very common after a half hour I've got to change. I actually change it to my arrow bars, and then it gets rid of it. So I keep changing
You keep
position.
back and forth, yeah. So if you want to learn how to floss the ulnar nerve, there it is again. Right there, Brad.
Floss.
Floss
Like
or
flossing
glide.
the teeth.
Yep, you're gliding the nerve back and forth, and you can loosen it up and maybe the pain will go away. The last one, less common, is the radial nerve in the upper extremity. I haven't seen this one very often,
Sure.
Brad, to be honest with you.
Right.
And that nerve comes off more the back of C5 to T1, again for you anatomy people. And that goes down the back of the arm, in the in the tricep. You can still feel it in the elbow, back of the forearm, and then if you look on here, this is the black hash marks on this one. So I don't think you're going to feel it in the hand as often as you might feel it in the elbow or the tricep. That's where I've seen it in people, is in the tricep.
Sure.
And it's a good one to try then. So that's the radial nerve. And you're gonna go ahead and try some flossing with that one, and we'll show you that's right here. Go ahead and click to that one. The last one, again, probably the most common one of all of these, because it's in the lower extremity, and
Sure.
a lot of people have sciatic nerve pain. And people, sciatica, they hear about that. The sciatic nerve, the largest nerve in the body,
Right.
goes down the back of the leg, kind of splits off, you get on the top of the foot and the bottom of the foot, and it often is caused by a pinched nerve in the back. A lot of times, like a herniated disc can
Sure,
cause it.
yeah.
But it could be pinching from a muscle here.
Tight muscle.
Yeah, piriformis muscle. Any one of those. But here, we're going to go ahead and show you that one. And that's going to be, that's a cool one too, right, Brad?
Mm-hmm.
All right, there they are, Brad.
That's it?
Yeah. That's
Okay,
good.
now, if you're 40 and over, they should continue to subscribe to us, because we can help you fix anything in that population, particularly except for,
Oh, a broken heart. We can't fix a broken heart.
but we're working on it.
And if you don't subscribe to us, we're going to come find you. We're going to make sure that you do. So,
Say no
I
more.
want to threaten people. Okay.